I'm Dr. Govindas Mittal, dermatologist from Bangalore, and today I will be telling you something about treatment of androgenetic alopecia or male pattern hair loss. And believe me, this might be one of the most important videos on this topic that you might have ever seen. So I'd like to compare the treatment of male pattern hair loss with growing a garden in front of your house. So to have a garden in front of your house, there are certain things that you have to do, that you must do, and there will be certain things that are desirable to do. So to have a garden and have your plants growing well, the basic things that you need is soil, air, water and sunlight. And if you want to grow your plants better, then you may want to add manure and fertilizers. And there may still be areas in your garden that are probably not responding to all those things that you're doing, and you may want to add some special hybrid plants over there to make your garden better and fuller. Similar is the treatment of androgenetic alopecia or male pattern baldness. So the basic thing that you need to maintain or to grow or to have hair while treating androgenetic alopecia is one, a hair growth promoting solution, something like minoxidil, which shall be prescribed to you by your dermatologist. That is something very basic that is required to maintain your hair in the growth phase. So it's a hair growth promoter. Second thing that you will need is something to block or reduce the DHT production at the hair root level. So drugs that do perform this action are drugs like finasteride, dutasteride and so on and so forth. So they help in reducing the DHT at the hair root level and thereby reducing the miniaturization of the hair or the thinning of the hair, which keeps happening in androgenetic alopecia. So these two medicines along with nutritional supplementation, vitamin supplementation is very basic to the treatment of hair fall. This is equal to soil, water, air and sunlight in your garden. Without these, your hair fall treatment will not be really that successful. Then comes what you may want to do additionally to improve your hair. Yes, treatments like derma roller, mesotherapy, platelet rich plasma therapy and low level laser therapy, these are adjuvant therapies that can be compared to using a fertilizer or manure in your garden. Yes, these therapies help in producing better hair, making your hair thicker, fuller, richer, but cannot replace the primary use of lotions that contain minoxidil with or without medicines like finasteride. So please understand that these treatments are add-ons and not a replacement. So just like you cannot keep adding fertilizer to your plants without watering your plants daily, similarly you have to use the lotions prescribed by a dermatologist on a regular long-term basis to maintain the results, and treatments like platelet rich plasma therapy add to these results. Then comes areas in the front of your scalp like the frontotemporal areas, or people who don't have a very good hairline and may want a thicker or a fuller appearance of hair in the front and want hairline to be created. For such patients, we may have to perform hair transplant surgeries, or it just like taking hair from the back of your scalp and implanting them or transplanting them to the front. This can be compared to buying very good plants or hybrid plants or borrowing some plants from your neighbor's garden to make your garden look better. Whether you do hair transplant or not, whether you borrow your neighbor's plants or not, you have to continue to water your garden. Yes, you have to continue to use lotions on your scalp that contain medicines like minoxidil and or finasteride, which will help in making your hair grow regularly and grow better. So I hope this video on information on various treatments for hair has helped you. Discuss these with your dermatologist and do not buy these medications by yourself over the counter. All the best.